Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other healthcare needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100.
Welcome to Gateway Today, the show that talks all things Gateway Community Health Center. I'm your host, David Cash Vasquez, and today it's all about the ladies, specifically women's health and women's health issues that women are seeing every single day. We'll focus on medications, treatments, examinations, and measures tailored specifically for women for your knowledge and your well-being. First up, we'll talk to family nurse practitioner Chris Lugo, who will guide us through specific treatments and vaccinations specifically designed to address women's health. Then we get a chance to catch up with Chief Medical Officer Dr. Mary Cortez, who will dispel some of the myths regarding women's health and the advances we're making here at Gateway to address women's preventative health care. Plus, Dr. Maria Antonieta Garcia will highlight our new residents and how she's preparing new doctors to take on new challenges in women's health. And finally, it's a topic that tends to get overlooked in women's health, but Dr. Sandra Contreras, our Chief Behavioral Officer, will talk about our behavioral health department addressing women's mental well-being at home and at work. We got a lot of show to cover, so make sure you sit back, relax. Another episode of Gateway Today starts now. Welcome to another episode of Gateway Today. Well, as promised, today is all about women's health, and we got a chance to catch up with family nurse practitioner Chris Lugo, who specializes in women's health right here at Gateway, and will highlight some of the vaccines and treatments that women should be looking out for in women's health. Check it out. All right, ladies and gentlemen, so we are here at our central clinic, and as part of our segment, we're talking about women's health services on Gateway Today, and I had to pull her away from work and make her come talk to us today. I'm very thankful to you. This is Miss Chris Lugo, our family nurse practitioner who really deals with our women's health services. And Chris, thanks for being here. We've got you Central Clinic, we've got you on the South Clinic. Tell me a little bit about what that day-to-day looks like for you when you're dealing with women's health.
So I see a lot of patients on Tuesdays and Thursdays, which are women's days. So if you know, that those are my gyn days that I see most women. And we do a lot of well woman exams. And a well woman exam, what entails is that a woman gets her pap smear done. So we check for any cervical cancer. We also check for sexually transmitted diseases. And we also do a manual breast exam. And we will also refer them to get their annual mammogram.
So with those exams, what are you seeing a lot of here specifically, just South Texas, of the patients in general, because every market's different with women? What are you seeing a lot of? What are your biggest concerns, and what are you hoping to prevent with women's health?
So as we screen most of our patients, we do, like I said, we do a lot of well woman exams, and my goal is to detect cervical cancer and breast cancer at an early stage, and that is the reason why we encourage our patients to not miss their annual well woman appointments. Come and get your screenings done, because it is quality of life that's important. So we want to make sure that our women are getting screened just in case that there is an abnormality in their pap smear, that we can intervene at an appropriate time in order for it to not be
turn into something even worse, right?
Correct.
And I think that that's the big message that we want to get across to our women watching today's episode. Tell me about that importance, that well women's exam. And I know you touched on it just right now, but is that maybe the issue that we're seeing within women's health, is that the women are avoiding these exams? Is that what?
So because a lot of the pandemic, a lot of women decided not to hold off on their annual Well Woman exam because a lot of women were scared to come into the clinics and get screened for it, putting their health on hold because they felt fine. And a lot of the times women feel fine and don't notice that they have some issues going on, and that's why they do their preventative visits. They put them on hold. So we are seeing more women come back into the clinic and getting their Well Woman exam done. We can't stress enough how important it is to check for cervical cancer, because cervical cancer is very important, and we want to check to see if women have human papillomavirus, which is HPV. It's part of the screening when we do their Well Woman exam, which can lead to cervical cancer and pharyngeal cancer, penile cancer, and anal cancer. So we stress that come back for your visits. COVID is done, and come back and start getting your screening.
Absolutely, is get it screened before it turns into something even greater, right? And I want to sort of ask you the importance of how often a woman should do this exam or these exams. Once a year, every 6 months? What's your recommendation?
So the ASCCP recommendations for cervical cancer guidelines have different time frames for women of different age, and it also all depends on the previous result and how long it's been since they've had their last pap smear done. So a Well Woman exam should be done on an annual basis. It does not necessarily mean that we will be screening for cervical cancer on every visit, but we do a pelvic exam, and we always take into consideration their age and a previous pap smear result is how often we decide it should be done. But a Well Woman exam should be done on an annual basis.
For any woman out there that just has questions about Well Women's exams, getting screened, or even treatments, we're able to help them with all of that, right? As far as medications or pharmacy, right? Working hand in hand for the best patient outcome, right?
Correct. We also have vaccines, which is the Gardasil, which also helps us prevent cervical cancer getting human papillomavirus. So that is also things that we do take into consideration in women that are the appropriate age still to receive that vaccine. So those are things that we look into.
And then like for contraception, things like that, we're also able to help them with that as well, right?
Absolutely. So the beauty about Gateway is that we have excellent federally funded programs here at the clinic that can assist a lot of patients with contraception, and we can discuss different types of contraceptive methods. We have every contraceptive method available here when it comes to oral contraceptions, IUDs with and without hormones, patches, Nexplanons, so rings that we can use. So that is also something that our Gateway patients have access to here with us.
Chris Lugo, everybody. She is a wealth of knowledge and really just at the front lines taking care of our women here at Gateway Community Health Center. We want to encourage you to get your Well Woman's exam. Come visit Chris or any of our staff here ready to help you get you screened and prevent any of these cancers or deadly forms of diseases that could potentially impact you. So find that woman in your life, your mom, your wife, your tios, your tias, and get them out here to Gateway Community Health Center so we can get them checked out. Chris, thank you for your time. Thank you all for watching.
Thank you.
Our thanks to Chris Lugo for her time. And if you'd like to get more information on vaccines and medications with regard to women's health, make sure you visit gatewaychc.com to get your appointment set up. Well, now our conversation shifts over to our Chief Medical Officer, Dr. Mary Cortez, who gave us a ton of insight with regard to women's health and things we should be looking out for. Check it out. All right, ladies and gentlemen, so as part of our women's health segment and series on Gateway today, we wanted to pull our Chief Medical Officer, Dr. Mary Cortez, over and get a little bit of information on some of the things that we're looking out for here at the clinic in regard to women's health. And Dr. Cortez, thanks for joining us. Dr. Cortez, tell me a little bit about lifestyle patterns that you're seeing within our patients that especially our women, that are kind of contributing to some of the symptoms we'll talk about here in a second?
Yeah, so it's basically the pattern in the community, right? Like a lot of sedentarism, poor diet, poor exercise. So that's a recommendation all the time. We do a healthy lifestyle so we can have a better outcomes, right? Exercising at least 30 minutes a day, every day, or most of the days of the week. Eating more veggies, a balanced diet, and avoiding cigarettes, smoking, vaping is another issue that we're facing. Stress, depression, anxiety, all of that is pretty common, unfortunately, in the community.
Sleep too, right? Like sleep is super critical
Yes.
because it's also something that might also be a telltale sign of some of the symptoms, right? Menopause. Tell me about that, right? Like how some of those may be a sign of menopause in women.
So we're seeing menopause around 50 years of age, right? When the women start having less frequent the menstrual period, and then it ceases. So they start having hot flashes. So it's like the heat and sensation that they present that interferes with sleep, and they wake up multiple times during the night, so they're more tired in the mornings. So we're seeing that a lot. We're treating women with menopause in the clinic. We are offering hormonal replacement therapy. That in the past has been some problems, people thinking that is a high risk, that we can develop cancer. So there are some strategies for us to treat menopause and prevent cancer at the same time.
And for anybody watching, do we know what causes? It's just a part of the life cycle, right? Menopause happens, right?
Yes, it happens around 50 years of age, sometimes early, sometimes later, or sometimes when we have surgery and they remove the ovaries, and that can cause menopause as well.
Now, staying on that topic, cervical and breast cancer, a huge illness that impacts communities all across the United States, including, and we're no exception. What are you seeing, and how are we treating breast and cervical cancer here at Gateway?
So the main focus on the clinic is to prevention, right? We don't want to see the cancer. Unfortunately, we see the cases, right? But the main focus here in the clinic is to prevention, referring our patients to our women's health department to the pap smears, the annual woman exam, pelvic exams, and then the mammography when they turn 40, or even before if they're having any symptoms of a breast lump or breast pain, etc.
So the exams are critical, right, in the prevention piece, because if it's diagnosed, that's a next step, and that's something that somebody would have to look at. But prevention, that's what we're doing here, and those exams to prevent it from either growing, spreading, or even happen here, right?
Yes, and what I tell my patients is that prevention, yes, you're not feeling any symptoms, you're feeling fine. Why to do it if I'm doing good, right? So the recommendation is to do it because if there's something abnormal that is starting to grow or starting to appear, we can remove it, and then that's it. But if we catch it too late, when there's a mass, when it's breast cancer is spread, the consequences are worse, right? They have to go into surgery, chemotherapy, radiation. So that's an unfortunate scenario.
Right, and so to try to advance prevention and stay on top of prevention, Gateway is also instituting mammography testing, or the machines, to really hone in on that prevention aspect. Tell me about that.
Yes, so right now we send the patients out to the hospitals to get the mammograms done. But now with the implementation of the radiology department, and right now we're doing x-rays, but we're bringing a mammography so we can have our own test done here in-house. and we will get faster results.
And mammograms are a key component to prevention, right?
Yes, it's the main screening for breast cancer, right? We recommend it after 40 years old, once a year, or even twice every 2 years if the case requires it.
Dr. Cortez, appreciate you pushing for our women. Appreciate the work that you're doing here at our clinic. If you want to find out more about your yearly exams, whether it's a breast, cervical exams, pap smears, visit gatewaychc.com. Get your Well Woman's exam for that woman in your life. Make sure they are getting screened on a regular basis. Prevention is key. And Dr. Cortez, again, we thank you for your time. And we thank you for watching. Our thanks to Dr. Mary Cortez for keeping us on the cutting edge when it comes to preventative healthcare in women's health. Our show now heads over to the residency department, where our director of residency, Dr. Maria Antonieta Garcia, is preparing new doctors for the new challenges new doctors will face in women's health. All right, ladies and gentlemen, so as part of our focus on women's health issues, I thought it'd be proper to bring in our program director for our residency clinic here at Gateway Community Health Center, Dr. Maria Antonieta Garcia. Dr. Garcia, thank you for being here with us to talk about how we're preparing our future doctors to handle women's health issues and the challenges there. Tell me a little bit about the program. In the years that you've been a part of it, tell me a little bit about how we prepare the residents to handle women's health.
Thanks for having me. So our residents are family medicine residents, and family medicine truly takes care of the whole family, women's health included. So we do some OB, we do prenatal care, from the first pregnancy test to the first ultrasound to the delivery. And then we can take care of the mom at the hospital afterwards and the baby as well. But OB is not the only part of women's health that we do. We also do basic gynecology, let's call it. So women can come in for their pap smears if they have any gynecologic issues, STD screening. And with the pap smear, that's a cervical cancer screening that women should get whether they have symptoms or not. And if their screening is abnormal, we can do the next steps in testing and even treat the abnormal test if needed with special lasers, if you will.
Yeah, preventative healthcare at its finest. What do you see a lot of with women's health, specifically here in South Texas? And what are you seeing patients not take advantage of that they should when it comes to women's health?
So definitely the screening. STDs are unfortunately very prevalent, and so we're able to screen our patients here and treat them with our pharmacy at reduced cost, as well as pap smears or cervical cancer screening. The patients don't know when they should be screened or how often. Sometimes they come in with advanced disease and cervical cancer. And so that's something that you can come in, talk to one of our residents, talk to one of our providers, see if screening is right for you, when it should be done, and what the next steps are from there. Or get your HPV vaccine, which is another preventative measure for cervical cancer.
Yeah, we heard our family nurse practitioner, Chris Lugo, talk about that and the importance of that and prevention. So make sure you get those vaccines, make sure you get screened. And finally, for the residents that are sort of focused or going to be dealing with these challenges, how are you pushing them to make sure they stay on top of new challenges when it comes to women's health?
So the residents are always learning. That's the best part of having a residency. We want everything they do to have evidence behind it, studies, research, journals. And then we practice before they ever touch a patient. So recently we had a suturing clinic where they learned how to sew up lacerations, specifically in OB. So we're always training, always studying, always pushing them to learn something new, so you can be sure that if you're seeing a resident, you're getting the best up-to-date care that we know.
Love it. Well, I appreciate the work that you're doing. And as always, it's always a fun time to bring you onto the program. Dr. Maria Antonieta Garcia, our program director for our residency clinic here at Gateway Community Health Center.
Thanks for having me.
Our thanks to Dr. Garcia for giving us a look inside our residency department and how our future doctors will take on the challenges they will see in women's health. Well, coming up after the break, we head over to our behavioral health department with our Chief Behavioral Officer, Dr. Sandra Contreras, who will shed some light on how our behavioral health department is addressing women's well-being at home and at work. More Gateway Today on the way. Stay close.
Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other healthcare needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100.
Welcome back to Gateway Today. Well, before the break, we promised we were headed over to our behavioral health department with our Chief Behavioral Health Officer, Dr. Sandra Contreras, who shed light on how our department is addressing women's well-being at home and at the workplace. Check it out. All right, ladies and gentlemen, so as part of our focus on women's health and women's health issues, I thought it would be important to bring on our Chief Behavioral Officer, Dr. Sandra Contreras, to talk a little bit about how stress, anxiety, and other behavioral health disorders or conditions may impact women's health and how we're addressing it here at Gateway. And Dr. Contreras, thanks for joining us. Tell me a little bit about what you're seeing in the behavioral health department with regard to women's health and women's health wellness when it comes to behavioral health.
Yeah, so a large majority of our patient population is female. Both youth and adult women. Most of what we see in regards to women's behavioral health conditions or mental health challenges are, things like depression and anxiety. So a lot of women, especially childbearing age, a lot of women who are in, the thickness of motherhood and working and things like that, have difficulty managing and balancing their lifestyles. And so this leads to things, like depression, anxiety, and things like that. So that's a lot of what we see.
How do you all as a behavioral health department address those issues for maybe a woman that's experiencing some of those issues? How do you all address it in the department? With what treatments?
With what treatments? So a lot of our licensed counselors are trained and specialized in different approaches and types of treatment. So one of the most common ones that we use is cognitive behavioral therapy, in which it helps individuals kind of challenge any unhelpful thoughts that they might have either about themselves or perceptions that they have about different events, and helps them challenge those thoughts, which can lead to helping them cope with their emotions and how they react to those emotions and behaviors and things like that. We also have one therapist right now, which is myself, trained in EMDR, which is a type of therapy that is mostly used for individuals who have experienced trauma, and a lot of our female population in our behavioral health have a trauma history, which includes domestic violence, sexual assault, sexual abuse, and all that kind of stuff. And so that has been really, really helpful for our women's population and our patients. And we currently have 2 other therapists who are going to be trained in this type of treatment as well. So we do a lot of different types of approaches, and we tailor our approaches to the needs of the patient.
Yeah, it's a wide range of issues that are facing our population, and I think also what's really, really important is the work-life balance, right? Aside from these traumatic experiences that you just highlighted, but that work-life balance and how women can find a calmness to managing that. What do you suggest?
So, and this is a lot of what we, or personally as well, the work that I do with my patients who do experience a lot of those just daily stressors and overwhelm and having difficulty managing everything in their lives. And so we develop a self-care plan. So, things that the person can do in order to take care of themselves, which goes beyond things like getting a manicure and going out shopping and things like that. All of those.
And it's funny you mention that, because a lot of times I think I think women are sort of advertised to or marketed to, like, hey, go do your nails and go shopping and everything's gonna be fine. But it's more self.
It's deeper than that. So, and there's different levels of self-care. So, you know, related to your own personal physical and emotional health, related to your relationships and things like that. And so your spirituality as well. And so we explore those different levels with patients, and we try to develop a plan to where they feel it's attainable to them, right? So we don't do something that seems so far-reached, right? So for example, you know, what are you doing to take care of your physical health? And of course, a lot of we're in a primary care clinic, so a lot of the women that we see have a lot of physical health concerns. So what are some small things that that you could do to improve your physical health? Exercise, nutrition, things like that. So that involves a lot of what we call motivational interviewing, meeting the patient where they're at in terms of what they can do. You know, there's a lot of talk nowadays about boundary setting. So setting boundaries and setting limits, knowing when to say no, not taking on everything. You don't need to do everything. And so advocating for yourself and things like that.
And Mama Bear always trying to take care of the house, right? Hold down the kids, but hold down the career and really trying to do it all, and setting boundaries for themselves will go a long way.
And we might make an assumption like, she's good, she's got it. But try not to make those assumptions and ask that woman, hey, what can I do to help you? What are you struggling with right now? Or sometimes maybe not even asking it and just doing it and taking some things off of her plate.
Well, I appreciate that insight, and I appreciate you pointing that out, because yes, we all have, despite our gender, we all have somebody special in our lives that is a woman, and we want to make sure that their wellness, their mindset, their overall well-being is taken care of. And so I appreciate you shedding light on it, because I think it goes a long way for that special woman in our lives. Dr. Sandra Contreras, our Chief Behavioral Health Officer here at Gateway Community Health Center, shedding light on women's issues and how we're addressing it here at Gateway Community Health Center. Our thanks to Dr. Sandra Contreras for highlighting how our behavioral health department is playing a role in women's health. And before the end of this show, we want to issue a challenge to you if you're a woman watching or you have a special woman in your life, to make sure you get your Well Woman's exam on a regular basis. And that all starts simply by going over to gatewaychc.com or by calling 956-795-8100. Remember, our doors are open to everyone, no matter your ability to pay, or if you have insurance or don't have insurance. We accept everyone as a patient here at Gateway Community Health Center. For a full rewind of this show or any of our other shows of Gateway Today, make sure you head over to our YouTube channel and search Gateway Community Health Center, and don't forget to smash that subscribe button. Again, we thank you for watching this installment of Gateway Today, and remember, your health is your wealth, so take care of it.
Gateway Sports Medicine brinda atención de calidad en Laredo y las áreas cercanas, ofreciendo servicios de medicina deportiva para todas las edades. Le damos la bienvenida al Dr. Eduardo Garza, médico de medicina deportiva. El Dr. Garza brinda su experiencia a Gateway Community Health Center, lo cual ayudará a sus pacientes a que continúen siendo atletas de alto rendimiento. Con el regreso a clases, evalúe a su atleta estrella hoy y dele la bienvenida al Dr. Eduardo Garza a Gateway Sports Medicine.